Welcome to the 2017 EMS Protocol Update for Paramedic Medications. The following medications will be covered: enalapril, ketamine, metoprolol, toprol, low pressor, rocuronium, Zamarin, tranexamic acid, TXA. While this presentation will give a good overview, it will be the responsibility of each provider to fully understand the medications that have been added or updated to the protocols. Enalapril, paramedic level medication. Used in protocol adult cardiac 5 congestive heart failure and pulmonary edema. Description: angiotensin converting enzyme inhibitor, ACE1, that inhibits ACE in human subjects and animals. ACE is a peptidyl dipeptidase that catalyzes the conversion of angiotensin 1 to the vasoconstrictor substance, angiotensin 2. Angiotensin 2 also stimulates aldosterone secretion by the adrenal cortex. Inhibition of ACE results in decreased plasma angiotensin 2, which leads to decreased vasopressor activity and to decreased aldosterone secretion. Although the latter decrease is small, it results in small increases of serum potassium, which is why it is commonly combined with a potassium-wasting diuretic. ACE1 relaxes blood vessels and helps the body release both water and sodium, reducing blood pressure and reducing edema and CHF. Dosing for this medication is as follows. Adult initial dose is 1.25 mg IV push over 2 to 5 minutes. Pharmacokinetics of this medication are as follows. Onset is typically within 15 to 30 minutes. The peak effect may not be seen for 4 hours. Duration: 12 to 24 hours, with the half-life being approximately 11 hours. Adverse effects for this medication are as follows. Hypotension has been seen in 5.2% of the population given. Do not give enalapril unless systolic blood pressure is greater than 120. Headache has been seen in 2.9% of the population given. Nausea has been seen in 1.1% of the population given. Angioedema has been seen in 0.1 to 0.7% of the population given. It is 5 times more common in African Americans. Angioedema with swelling of the face, extremities, lips, tongue, glottis, and larynx may not respond as well to standard treatment for allergic reactions. Ketamine, paramedic level medication. Adult respiratory airway, drug assisted. Adult respiratory 5 pediatric airway, consider use. Adult respiratory 8 post-intubation. Blind insertion airway device management. Description: ketamine is a rapid-acting non-barbiturate general anesthetic. It produces an anesthetic state characterized by profound analgesia, normal pharyngeal-laryngeal reflexes, normal or slightly enhanced skeletal muscle tone, cardiovascular and respiratory stimulation, and occasionally a transient and minimal respiratory depression. A patent airway is maintained partly by virtue of unimpaired pharyngeal and laryngeal reflexes. The anesthetic state produced by ketamine has been termed dissociative anesthesia. It appears to selectively interrupt association pathways of the brain before producing sensory blockade. Dosing for this medication is as follows: 1.5 to 2 mg per kg intravenous or intraosseous. Airway management with a dangerously combative patient, 300 to 400 mg intramuscular. Pharmacokinetics for this medication is as follows. Following intravenous administration, the ketamine concentration has an initial slope. An alpha phase lasting about 45 minutes with a half-life of 10 to 15 minutes. This first phase corresponds clinically to the anesthetic effect of the drug. Onset: has a rapid onset, within 30 seconds, when given intravenously. Intramuscular: within 3 to 4 minutes. Duration: intravenous 1.5 to 2 mg per kg lasts 5 to 10 minutes. Intramuscular: 4 mg per kg lasts 12 to 25 minutes. Adverse effects for this medication: cardiovascular, blood pressure and pulse rate are frequently elevated following administration of ketamine alone. However, hypotension and bradycardia have been observed. Arrhythmia has also occurred. Respiration: although respiration is frequently stimulated, severe depression of respiration or apnea may occur following rapid intravenous administration of high doses of ketamine. Laryngospasms and other forms of airway obstruction have occurred during ketamine anesthesia. Adverse effects for the eyes, diplopia, and nystagmus have been noted following ketamine administration. It also may cause a slight elevation in intraocular pressure measurement. Neurological adverse effects: in some patients, enhanced skeletal muscle tone may be manifested by tonic and clonic movements sometimes resembling seizures. Gastrointestinal, anorexia, nausea and vomiting have been observed. However, this is not usually severe and allows the great majority of patients to take liquids by mouth shortly after regaining consciousness. General adverse effects of this medication can include anaphylaxis, localized pain, and exanthema at the injection site have been infrequently reported. Transient erythema and/or morbilliform rash have also been reported. Metoprolol, Toprol, low pressure, paramedic level medication. Universal Protocol 14, suspected stroke, consider use, adult cardiac 4, chest pain, cardiac and STEMI adult cardiac 6, adult tachycardia, narrow complex, under 0.11 seconds. Description: beta-1 receptor blocker type, decreases heart rate, contractility and cardiac output, therefore decreasing blood pressure. Utilized to treat hypertension, anginal chest pain related to poor blood flow to the heart, and narrow complex tachycardia. Prevents the extension of acute myocardial infarction by decreasing the demand upon the heart. Dosing for this medication is as follows: Universal Protocol 14, suspected stroke, if systolic blood pressure is greater than 220, diastolic blood pressure is greater than 120 and pulse is greater than 60 after 3 readings, at least 5 minutes apart, contact receiving facility or medical control to request metoprolol 5 mg intravenous or intraosseous, may repeat once as needed. Adult Cardiac Protocol 4, chest pain, cardiac and STEMI, with an acute MI. STEMI, if blood pressure is greater than 120 systolic and pulse is greater than 60, give metoprolol 5 mg intravenous or intraosseous, may repeat per medical control or receiving facility. Adult Cardiac Protocol 6, adult tachycardia, narrow complex, less than or equal to 0.11 seconds, both regular and irregular rhythm, contact medical control or receiving facility and request metoprolol 5 mg intravenous or intraosseous, may repeat once after 5 minutes as needed. Pharmacokinetics: intravenous metoprolol begins to work within seconds, its maximal beta blocking effect is seen at 20 minutes. This medication has a half-life of 3 to 7 hours. 95% of the medication is cleared by the liver, 5% by the kidneys. 5 mg intravenous metoprolol is approximately equivalent to 12.5 mg given orally. Adverse effects for this medication: bradycardia, hypotension. May exacerbate reactive airway disease, COPD. Asthma. Can exacerbate sick sinus syndrome and AV blocks, especially when combined with amiodarone. Tiredness, dizziness, depression, diarrhea, itching, rash, occurring in 5 to 10% of patients. Rocuronium, Zamarin, paramedic level medication. Adult respiratory 3 airway, drug assisted. Adult respiratory 8 post-intubation, blind insertion airway device management. Description: non-depolarizing, no muscle twitching, neuromuscular blocking agent, acts by competing for cholinergic receptors at the motor end plate. Paralytic agent, must have monitoring and airway management equipment available at all times. Dosing for this medication is as follows: adult respiratory 3 protocol, airway, drug assisted. If succinylcholine is contraindicated due to hyperkalemia, renal failure, glaucoma, or malignant hyperthermia, rocuronium should be considered at 1 mg per kilogram intravenous or intraosseous, may repeat 1 time. Adult respiratory protocol 8, post-intubation, blind insertion airway device management. For continued paralysis in the intubated patient after initial use, 50 mg, 0.6 mg per kilogram, intravenous or intraosseous push, as needed for patient movement. Not indicated in pediatrics. Pharmacokinetics: Onset of action is usually within 60 seconds. Half-life is 66 to 80 minutes. Primary elimination is by the liver. Consider reduced dosing with advanced age and history of liver failure. Adverse effects for this medication: hypotension, hypertension, arrhythmia, allergic reactions, anaphylaxis. Apnea will occur without assisted ventilation, asthma, bronchospasm, and wheezing. Tranexamic acid, TXA, paramedic level medication. Adult medical 5, hypotension. Shock, consider. Trauma and burn section 6, multiple trauma. Description: antifibrinolytic agent, prevents clot breakdown. Indicated for ages 18 or greater in trauma patients with signs and symptoms of shock, suspicion of internal hemorrhage and anticipation of blood transfusion. Indication includes blood pressure less than 100 systolic, heart rate greater than 110, altered level of consciousness, pale and diaphoretic. Contraindications include time greater than 3 hours from onset of injury, shock, and non-hemorrhagic shock. Additional contraindications include evidence or history of intravascular clotting, DVT, PE, thrombotic stroke. Dosing for this medication is as follows: loading dose of TXA, 1 gram in 100 ml of normal saline, over 10 minutes. Pharmacokinetics: peak plasma TXA concentration is obtained immediately after IV administration. Urinary excretion 95%. Elimination half-life is 3 hours. Adverse effects for this medication: thrombogenic side effects, promotes clots. Nausea, vomiting or diarrhea has been seen in up to 30% of studies. While rare, under 1%, there have been reports of dizziness, impaired vision, rash, seizures, and urinary retention. Be wary of signs of blood clot in blood vessels with difficulty breathing and chest pain from pulmonary embolus or acute MI, acute thrombotic stroke, swelling in one extremity from DVT. It is the responsibility of each department along with each EMS provider to be proficient in the use of these medications. If you have questions about this presentation or any other information related to the protocol update, you should direct them to your training officer for clarification.